We all know that accessing healthcare globally is still a challenge, particularly depending on where you originate from. So I'll give you an example. If you were working in the NHS, as in you were living in England, accessing the NHS, there are waiting lists. Now, you can bypass the waiting list and go private. So you can go either through insurance or self-pay. Great Britain, the prices are higher. So Nigerians are coming back to Nigeria to seek medical treatment, and that's popular. So this holiday seasons can be quite popular for patients who are coming back home, and they're not only just achieving a holiday with their families, but they're also getting healthcare. I'll give you an example. I did a gentleman just today, colonoscopy, was waiting on the NHS for many months, got a little bit fed up, looked at having it done privately, got a price, made some inquiries, looked at the price in Nigeria, was coming to Nigeria for Christmas, compared the price. Of course, there's a saving. He decided with his family when they were in Lagos to have the colonoscopy. He's just had it. Luckily, nothing found, no problem. He's very pleased. He's going back to London over the weekend. So what I'm saying is that is common. So simple things, elective things, colonoscopies, endoscopies. Now, the more complex ones are weight loss surgeries. So again, coming from the United Kingdom, you could either have it on the NHS, you could go private, you could go Turkey, or you come to Nigeria. It's all choice. Now, people are choosing to come and have it in Nigeria. Now, they do make a lot of inquiries beforehand so that they can commit. So they make sure they research us very well. They look at any, what we will call media presence, both good and bad, just to get a flavor. And then they talk to us. And then hopefully, if they feel comfortable, they'll come and we get treatment. So that's very popular. So those are the two ones that I think are relatively popular. Now, people get into emergencies, which means that they are completely well, come into Lagos, either living or visiting, and get into trouble, become an emergency. That's now urgent care. And we offer that because, of course, we're available. So we would do, the other day I did a gentleman who had a gallstone. He had a gallbladder stone, it caused an infection. He was quite in a lot of pain. He came here, we did a CAT scan and ultrasound, quick diagnosis, conversation. The following day, he had his surgery, removed his gallbladder as an emergency, and he's done well, he went home. That is a small, unpredictable category, but an important category. Otherwise, they stay on the ward a week, antibiotics, a lot of pain, maybe change in diet. He was able to bypass all of that, have his surgery, he's recovered, he's going home, he's been home and he's fine, and of course he doesn't need to wait to have surgery later on. Big advantage of having it. So yes, that's the summary of the three categories of patients that we tend to see.